view, you can see the anterior interventricular sulcus, right? It's diagonal. That's how you remember that. This is the apex. This is the base. Left auricle, right auricle, pulmonary trunk. This is the aorta. The first branch here is called the brachiocephalic trunk. Okay, everybody with me so far? Mm-hmm. Pretty easy. And back, you know this is the posterior view because this is diagonal, and the posterior interventricular sulcus makes a T with the coronary sulcus. So this is the coronary sulcus, and this is the posterior interventricular sulcus. Again, apex, base. Now from this view, from the back, you're going to see the aorta, the brachiocephalic trunk, and the pulmonary trunk here. Again, this is the, which auricle is this?
Left.
And this is the?
Right.
And this one is still intact, so if I pin up here, what is that? Superior vena cava. If I pin down here?
Inferior
vena cava. Because see, their openings are still intact. What wasn't in, oh no, it's still intact. Is it? No, it was cut. So generally I can find a heart that still has a little place intact there. And so this is coming in from the right side. So this is the right pulmonary veins, and these are the left pulmonary veins. Okay? Inside the auricles, you will see the pectinate muscle. Pectinate means comb, so it kind of looks like teeth on a comb. This one you can see easier. Right? So that's the pectinate muscle. Now if I open it up, this in the middle is called the interventricular septum. If I want myocardium, I usually pin it on the left ventricle. See how thick the myocardium is there? It's much thinner on the right ventricle. On the right side, you have the moderator band, and you only have the moderator band on the right ventricle. This is the tricuspid valve, or also known as the right AV valve, and it's called that because these are the cusps, and there's three of them. These are the chordae tendineae, and they're attached to papillary muscles. But you can see the papillary muscles better on the left side. This is the two cusps of the bicuspid or left AV valve, chordae tendineae. See these smooth, huge bumps? What are those? Papillary muscle. The trabeculae carneae, right? It kind of looks like these branching things here. Anybody know what these things are?
The Purkinje fibers.
Purkinje fibers. I don't pin, but they're cool that they still are intact. So now, if I go from the inside to the outside, and I have this opened up, I'm not asking for the aorta. What am I asking for? The valve. What is the name of this valve? The aortic semilunar valve, or just the aortic valve is fine. How about the pulmonary trunk? What would the name of that valve be? Yeah, and I have to go from here because it's so hard to get into the atrium. I mean the valve here. So there is the pulmonary semilunar valve, and again you can see the white, right? Yeah, pulmonary valve. You can say that. And all this whitish stuff, what is that? Everywhere on the inside of the heart and on the valves. Endocardium. Endocardium. Okay, that's it.
Okay, so we had questions on the layers of the heart. Can you see?
Where I say I can pin the layers of the heart.
I can, yeah. So
And I just ask you to say pericardial sac or pericardium because that includes all three layers.
Okay. Our last question was the epicardium. Okay.
Yeah, that includes it.
Okay.
Where's the septum again? The interventricular septum?
Right in the middle. Inter means in between the two ventricles. So that's the interventricular septum. Okay. Any other questions?
Yeah.
Endocardium you're going to do?
I would ask for the shiny white stuff.
Shiny white stuff.
Yeah, because that's what it is. All over the inside of the heart. All of this. And in the lining of the blood vessels and the valves, right, is the endocardium. Okay.